Greetings from Missouri Enterprise, the Show Me State's manufacturing experts. We're proud to be partnering with Associated Industries of Missouri to bring you a timely webinar on workplace wellness and why it's especially important in the recruitment retention game. President of AIM, Ray McCarty, will moderate the session, serving as the voice of the business community. He will be joined by our expert, April Schmidt, who has a proven track record of success working with major companies to develop long-term workforce strategies and programs. You are, of course, free to email and share this session with anyone on your team. And if you have any additional questions, feel free to email us at the end. Here's Ray and April with more.
Hi, I'm Ray McCarty, President of Associated Industries of Missouri. Glad to have you with us today. Today we're going to talk about workplace wellness. We have April with us. Introduce yourself, April.
Hello, everybody. My name is April Schmidt. I'm a project manager with Missouri Enterprise who is extremely passionate about healthcare and wellness and organizational change and how all of those can be combined into one.
Well, let's get started. Wellness is a hot topic right now anyway, isn't it?
It certainly is in different aspects of wellness. And so when we're talking about wellness, I want us to kind of think about from the frame of there's multiple dimensions of wellness. There's 8 of them. And so I have them here on this slide. And thinking about some of the ones we most often think of are social wellness, spiritual wellness, emotional wellness, physical wellness, financial wellness. Those are ones that probably come to mind most often when we start thinking about wellness. But there's also intellectual and environmental and occupational wellness too that also combine this whole approach to how we want to think about different dimensions of wellness. So one of the things I like to be able to think about is, so why wellness? Like, why does this matter as an employer? And we know there's a link between health and productivity. The healthier employees are, the more often they're at work and the more productive that they are as well. So wanting to focus on, so how do we start to create this culture of wellness? And what can you as employers do to be able to support employees in this journey and this culture of wellness? So one of the things that I have is just looking at how do you create that? And they talk about creating a working environment where employee health and safety is valued, supported, and promoted through workplace programs, policies, and benefits. Thinking about your company and how it's structured. So as we talk about strategic planning and looking at mission, vision, value statements and different things that organizations do, how does what you do from a health perspective for your employees fall into that? And thinking about for this truly to become part of a cultural change, you need to have employees at all levels of the company engaged and really wanting to work towards promoting wellness in the workplace.
Can I ask you a question? So right now, our employers are trying to find employees wherever they can. And so they're trying to make their workplaces as attractive as they can. So often they're looking at the benefits packages. This is something that should not be left out of a benefits package, because I have a feeling a lot of the younger workers that we're trying to target probably value this as a component. Would that be right?
Absolutely, and one of the slides coming up, we talk about that. We're thinking about different benefits that you offer to your employees in regards to insurance and health are very attractive. That's one of the things that as an employer can make you a differentiator from some of your other competitors.
Right, okay, good.
Yeah. And so one of the things that we want to be able to think about is when you start to create this culture of wellness, then you start to have employees who are empowered, and when they're feeling better, they're engaged in their health, they're more engaged employees in their work, they're more productive, and they're at work more often. Mm-hmm. And hopefully that also helps you with your retention rates for employees as well.
Sure, wonderful.
So again, just another thinking about creating that culture of health. Is you want it to become part of that worker's everyday environment. It's not just a one day a week. On Wednesdays, we do workplace wellness. Mm-hmm. It's how does workplace wellness maybe start as a Wednesday, but become an everyday approach? How do you start to give those informations and those tips to employees and the supports and resources and tools to really have it become a part of your everyday thing that you do at your company? Whether it's through, we'll talk about, kind of lunch and learns, vaccine fairs, information, pamphlets, brochures, things to really help employees take care of their health. And one of the reasons that we talk about, so you were talking about here too, that it becomes a competitive advantage, right? Making it an attractive workplace, mm-hmm. Where for some individuals, that's extremely important to be thinking about. Is there a fitness benefit offered, or is there a fitness facility on site? Are they contracted with a fitness facility that they could maybe do that at? Is there, we talk about EAP programs or employee assistance programs. What are those different benefits that are available? Do they have kind of fun challenges to really encourage wellness and say, all right, this week our goal is to walk, and instead of maybe 10,000 steps, we're going to see if we can do 12,000. Things like that can make it be fun in a supportive environment.
So you'd suggest that an employer be creative about how they think about this, and maybe seek some help from their employees on how to make this more interesting, right?
Absolutely. As we talk about needing to engage your employees and the importance of creating that cultural shift and bringing individuals in at all levels, this is a great way to be able to pull from employees to be really creative and say, what can we as an employer do to help you as employees become healthier? And what are some fun and creative ways that we can do that?
Great.
And why it's so important to have healthy employees is we know healthcare costs are not going down, right? They're continuing to rise.
Of course.
So I pulled some information that just talks about, it says health insurance is the single most expensive benefit offered by employers. And it's also important to hiring and retaining the best talent. So I pulled also some information that's specific to Missouri. That was from the Kaiser Family Foundation, where it talks about on average, and so I know sometimes averages can be deceiving because you can have some that are prices that are fairly close and one or two that may be on extremes that can throw an average off. But on average, an employee in Missouri contributes about $1,400 per year to their insurance. An employer is about $5,261 at this point in time. So the annual premium is around $6,600. Now, that doesn't include cost of deductible or any out-of-pocket expenses. That's just for the cost of the premium.
Wow.
So thinking about one of the ways that you can reduce the cost of your health insurance and your premiums is by having, working to engage and have a healthier workforce as well. And we'll talk about some ideas and opportunities to be able to do that. So when we talk about employees and health and wellness, one of the things to also talk about is chronic conditions that individuals may have. Right now, we know about 6 in 10 individuals have what would be considered a chronic health condition. And those include heart disease, cancer, chronic lung disease. Those are, I have listed the top 7 conditions that are contributing to the $3.5 trillion in healthcare costs that the U.S. faces every year. And we know about 4 in 10 adults have 2 or more chronic conditions.
Wow.
So the more that as employers can work towards how can we help individuals identify chronic conditions that they may have, how can we help them manage symptoms of them so that they can also feel their best as well, in working to be able to provide information. And that's where we see in some of the insurance plans that there's now these preventative wellness benefits.
Right.
Because we know if individuals, if we can identify them early prior to them developing a chronic condition, that there's still that opportunity to help adjust and change lifestyle choices and behaviors to hopefully prevent them from developing a chronic condition.
Well, I noticed chronic pain is not even on the list, and when you mix that in there, I bet you're really, really high in terms of numbers of employees that are impacted.
Absolutely. And I think in some of them, when we talk about chronic conditions, and you talk about physical conditions, and then we know about 50% of individuals with a chronic, what we would think of as a chronic medical condition, also have a mental health condition, typically anxiety or depression. And a lot of those individuals may not identify an emotional feeling, but those things will show up in a physical feeling.
Sure, a clinical type depression.
Yeah. So they tend to go hand in hand.
Sure.
So when we talk about individuals, and I love this term presenteeism, when we think, and then talking about that, that's when you have employees who come to work but aren't necessarily functioning at their full capacity for a health-related reason. So they're there and they're physically there, but mentally they're not feeling their best.
The lights are on, but no one's home.
Yeah. So when you have individuals who are coming to work and they're not feeling at their best, that's where we see that there's an increase in likelihood of mistakes, and those errors can be a real safety concern depending on what area of manufacturing or what type of work individuals are in. One of the things that we look at, so Forbes in April of 2019 indicated that presenteeism cost the U.S. economy more than $150 billion per year.
Wow.
When I was doing some research, information showed that the number of employees, or average, was about 57 days of presenteeism based on one particular study.
How do they measure that, I wonder?
It's
hey, April, you're here, but I don't really think you're up to par.
Yeah, so very subjectively. So it's asking,
Yeah.
doing those phone studies and asking individuals,
Okay.
about how often that they felt that had happened.
Okay.
I mean, it's one study, so I couldn't find other ones that really
That's pretty cool, though.
could kind of replicate that, because it is so subjective based on individuals and their feeling if they were working at their most optimal level or
Okay.
not. But we do know when individuals come to work sick and not feeling their best, they're a third or more less productive.
Makes sense.
So we know that.
And they're probably more likely to cause an accident too, which would also affect your work comp claims. And
Absolutely, and we'll talk a little bit later in one of the slides about some of the what the research shows in terms of safety-related incidents, especially related to fatigue and sleep deprivation.
Okay.
That'll be extremely important. So one of the things in thinking about some of the risks for chronic disease is we know that tobacco use, poor nutrition, lack of physical activity, and excessive alcohol use are all things that contribute to that chronic disease development. And thinking about what is an employer, what can you do to be able to help support, empower, or educate employees? So are you a smoke-free campus? Do you have a tobacco cessation program that's part of your insurance benefit? And do you make sure employees know that that's available to them and support them? In regards to the lack of physical activity, that's where we're talking about some of those kind of fun wellness challenges, and that fitness reimbursement programs or different fitness programs or gyms that maybe employers can work with to be able to see if what they can make available to their employees. And really trying to encourage some of those things. Or, Fitbits are really big and popular.
They are.
If there's a way to be able to track that and do kind of like a steps challenge, things like that are ways that you can help employees, work towards wellness and also help manage some of those risks for chronic diseases.
And there are generic Fitbits out there. I wasn't aware until this week. One of my friends in the Capitol had one, and I was amazed. But yeah, you can buy them for like $30 now and measure your steps and heart rate and all of that too.
So lots of technology out there, and I think some of the phones even have that built into where if you have it, depending on where you have your phone, it might overcalculate some of your steps.
Right.
But being able to utilize some of those things on your phone and some of the apps that are available now too, and fitness apps on your phone that can track your progress. And
Well, I found myself. I mean, I had a Fitbit, and then I stopped using it because I found myself cheating. I was like, doing this when I'm going up an escalator, So it was really kind of self-defeating. So I just outed myself. But that's why I don't wear one anymore, because it was like I thought I don't need to know how many steps. I'm going to know if I'm losing weight or not.
So as we talk about that presenteeism and individuals maybe coming to work, especially if they're physically not feeling well with something like cold. I know we've got right now the concerns about coronavirus. We're still in flu season. There's allergies that are now coming out too. We know that sometimes individuals come to work because they may not have time off, or they may not accrue benefits for that. They might fear losing their job. Some places may have very strict attendance policies where maybe you only have a couple of days available to be sick, and then you're let go. So they may be like, okay, well, I don't want to potentially jeopardize my employment, so I'm going to come into work even though I know that I'm not feeling well.
And that can completely backfire, because then you have more people sick and it just gets worse.
Absolutely. So one of the things that I talk about is, does your attendance policy inadvertently encourage employees to come to work if they're sick, because there's fear of repercussions in some other way. So making sure that your policy doesn't penalize individuals for staying home when they truly are sick, because if they come to work sick, they could potentially infect a number of other individuals. So them staying home 1 or 2 days may actually be more cost effective in terms of health and wellness wise, not only for them, but for the company and employees. And in some environments, if you have an employee who comes in sick, depending on the type of work that they're doing, it may be significant where you actually may need to ask them to go home because they can't be in that particular environment if they have something that's contagious. And we know that companies are feeling the pinch in terms of retention and needing to find employees and not having the number of employees that they're needing. And sometimes individuals end up coming into work sick because they know if they don't come in, there's not somebody who's going to be able to do the work for them and feel like they're burdening their coworkers.
Yeah, your conscientious employees are probably the ones that are worst about saying, oh, it's okay, I can work through it. But they really are harming the whole environment.
And so being able to make sure, again, that the environment and that there's that support there to say, well, you know what, we really appreciate the fact that you're conscientious and that you're dedicated to your work and that you want to come in and you're concerned about burdening your employees with having to do the work while you're out. However, we need you to stay home so that you don't get everybody else sick and kind of create, greater health issues in that sense.
Well, and today with automation and being able to work from home is a real possibility for a lot of jobs, and that's a real attractive option if you have someone who's sick, to have them work from home rather than coming in and getting everyone else sick. So that's something employers ought to consider too, huh?
Absolutely. Thinking about what roles in a particular company are able to work remotely, and then making sure that you enable employees to do that. So once you've done that analysis of what jobs have the capacity to be able to work remotely, getting those individuals set up and ensuring that all of those systems for them to work remotely are in place prior to them needing to work from home.
If they're a conscientious employee, what I've found is if you allow them to work from home and they split the hours up, it may not be the straight 8 to 5 hours that they work, but you often get more out of the employee because they'll say, okay, I'm doing a couple of hours now in between, what I'm doing with my children or whatever, and then a couple hours later. And I know I found myself, I'm kind of a workaholic anyway, but I found when I was self-employed, I worked far more than I did when I worked for somebody else.
Well, and I think, it goes back to when we talk about empowering your employees, just in a general sense, and allowing them some sense of ownership, that you will have some of those employees who really find that when they can be flexible with their hours and their scheduling, that they end up being maybe more productive,
right?
And being able to get more accomplished and being able to flex around other commitments is very attractive. So again, it's one of those things when you're looking at a competitive differentiator between employers. Is there the ability to work from home? Is there that flexibility to adjust your schedule? Again, and can be a determining factor for somebody when you're looking at hiring individuals. And then again, so as we're talking about those conscientious employees, they don't want to be seen as not doing their fair share of the work. They don't want to be seen as being a slacker. And for some individuals, especially if they're working towards a promotion, they may not want to be seen as not being able to they don't want to do something that maybe potentially damages their ability to be seen as being eligible for a promotion. So it's that fine line balance in that gray area between you want employees to come to work when they're well, but you also want them to stay home when they're sick.
Sure.
So one of the things that I think is really important as we're talking about aspects of wellness is fatigue. And I know some industries that individuals, their shifts might include some off hours or might be extended hour shifts, and those are things that can set them up for fatigue. So one of the things that, other things we know that can work towards fatigue is just poor sleep or interrupted sleep. And some of that, as we talk about stress, can be linked to stress that individuals are experiencing. And we know that fatigue is something that happens. Your body is telling you need to take some time and you need to rest. That's what your body's telling you. We know long hours, extended and irregular shifts can be stressful physically, mentally, and can contribute towards fatigue. And demanding work schedules can also disrupt your natural sleep cycle, and then you've got the fatigue and that stress and that lack of concentration that comes along with all of those things too.
Oh, I have a horrible trouble with this. So I will wake up at 3 o'clock in the morning to go to the restroom and start thinking about work, and then not be able to get back to sleep. And then the next day I am just, totally fatigued. But when your brain starts thinking about things and there's no way to really cut it off sometimes. So I started using melatonin. That helped a lot.
And I find, so my dogs have me conditioned to let them out around midnight. So
Oh
usually
my.
between like midnight and 1:30, that's usually their time. So I'm typically up almost every night with them, sometime between 12 and 1:30.
Wow.
To let them out. So my body has been conditioned to wake up around sometime in between there, because I know that they're going to wake up and say that they want to go outside. And so it is. And sometimes I've just started keeping like a notebook nearby, because I will wake up and then I'll have all of these thoughts of things that I need to do.
That's a good plan.
And if I don't write it down, it's like, oh, I know I'm going to forget it.
Yes.
And so thinking about some of those things, if you do wake up in the middle of the night, what are those things that are keeping you awake, and like, can you just jot it down like I do in a notebook, so that you can kind of stop your mind from kind of processing and thinking about all of those things, so that you can get back into that sleep cycle.
That's good advice.
We also know, as we talk about fatigue, right, makes individuals at risk for illness as well as injuries.
Sure.
And we know that stress kind of plays into that too. Past research has shown that after a stressful event, individual's immune system drops within 30 minutes of it.
Wow.
So sometimes if you've been like, oh, I'm so stressed, and then whatever's causing you stress is that event dissipates, and then it's like, and then you ended up being sick. Right? And it could sometimes be even things that are good stress, like you're planning for vacation, you go on vacation, you have a really great time, but then now you've got to come back to work, and you've got all these things that are your home, and you've got all these things that are needing to be done in a week's worth of mail, and all of those things.
True.
So, but we know that stress, impacts your immune system, and it makes you more likely to get sick. And if you're fatigued and you're not getting all the sleep that you need, and you're not probably eating very well, and we know poor nutrition plays a role too, that you're going to be more susceptible to illness. So how do you then kind of work towards addressing some of those things?
Right.
So we know that accident and injury rates are 18% greater during evening shifts.
Wow.
And this is from OSHA. This information I got from OSHA, and 30% greater during night shifts when compared to day shifts.
Whoa.
So for individuals, so that if you're an industry and you have a safety committee, this is a great opportunity for you to be able to look at your information about maybe scrap, rework, injuries, some of that data that your safety committee looks at, and then be able to look at it to see, does this information ring true for your particular company as well? Are you finding that there's greater injuries and accidents that are happening on evening shifts versus your day shifts? And then being able to identify what do you maybe need to do to be able to help address those risks, and to be able to help keep employees safe.
Makes sense.
We also know that individuals working 12 hours per day is associated with a 37% increased risk of injury.
Wow.
And again, some of it is just once individuals are up for an extended period of time, right, your body starts to become tired and fatigued.
Sure.
And we know estimated annual costs from fatigue-related illness, fatigue-related, health-related lost productivity is about 1.36.4 million. So I said that wrong. 136.4 billion. There, now I got my numbers right.
Wow, that's a really big number. You're not used to saying it. It doesn't roll off the tongue.
It's not one of those numbers that you're just like, oh yeah. You say it daily.
Wow,
So
that's
being able
staggering.
to think about all of those things, and when knowing again that if you know that 12-hour shifts places individuals at risk for injury, is there what are some of those things that you can potentially do as an employer to help with that, and to and I know every industry is different, so sometimes you don't have where individuals can rotate through different jobs throughout that 12-hour shift. And looking at if there's opportunities for set breaks in between there to be able to break that up so that individuals don't start getting tired and fatigued, or you work to try to minimize that as much as possible. So if you can minimize that, then you'll see a reduction in injuries as well.
Sure.
And so we were talking about stress, right? Everybody has stress, and there's good stress, they called eustress, and then there's the regular stress that we think of that causes you to feel distress.
Right.
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 So in looking at what are some of those top stressors that individuals face, right? Number one, job pressure. Two, thinking about, money and financial things. 3 is health. 4, relationships. 5 is poor nutrition. 6, media overload. not terribly surprising with the rise in social media and Facebook and Twitter and Instagram and social networks. That individuals spend a lot of time on that, and the more that individuals get engaged in that. I remember reading a study a while back that was talking about just that kind of emotional distress individuals were feeling in terms of like that they weren't measuring up to other counterparts or individuals who are on social media,
right.
And how that was kind of contributing to individuals' feelings of I don't know that I could say it like depression, but just kind of, that feeling that they weren't measuring up in some way based on all of what everybody else was posting and the kind of that keeping up with the Joneses.
Well, it's just like the old song by Styx, Grand Illusion. Any of the people who out there are rock and rollers will understand that. But that song talks about how, you're made to think that you are not measuring up because of what you see in the media. Now, we see it every day, every hour on Facebook, and people only post things they want you to see. They don't post all the negative stuff that goes along with it. So you got to remember that when you're looking at it, that it's not that you're not measuring up. People are not posting all the bad stuff that happens in your life. So
we tend to want to share those successes with others and not so much like, oh, hey, this is the as you were talking about, we don't really post about like the negative things that are happening.
We're all shining diamonds on Facebook.
Absolutely. And number 7, sleep deprivation that we were just kind of talking about and how that relates to worker fatigue and how that can play into some of those things. And so when we talk about the percentage of individuals who are experiencing stress, so again, talking about laying awake at night due to stress, 48% of individuals.
Wow.
So if you have 48% of individuals who are feeling stressed, who aren't sleeping well, sets them up for sleep deprivation and also fatigue, right?
Wow.
So thinking about some of those things. And then we also look at, the number of individuals who experiences physical symptoms that we were talking about. That can be, like stomach aches, nausea, headaches, those might be some of the muscle tension aches. Those are things that individuals who maybe are experiencing stress but are feeling it physiologically, meaning they're feeling it physically. So those are some of the things that, to be just kind of reflective of and thinking about. So when we talk about those effects of stress, that last one that we were talking about, when stress becomes long-term and chronic, not just kind of once in a while, lasts for a couple of days, but when stress becomes long-term and chronic, that can lead to depression, high blood pressure, hardening of the arteries, which they also call atherosclerosis, stomach ulcers, heart disease, puts individuals at risk for a heart attack. Individuals may experience weight loss or weight gain depending on how each person responds individually to stress. They might have skin issues and start breaking out with like acne, eczema, or if they have psoriasis, noting flare-ups with those things. And if they have asthma or arthritis, flare-ups. Because when you talk about stress, there's this whole neurochemical response and reaction that triggers this physiological reaction and that release of stress hormones. And that's what's, that long-term exposure to those stress hormones is what causes all these physical things that we're seeing, and why they were talking about if stress is long-term and unmanaged can lead to some of these complications.
I never would have guessed. I never would have guessed that the two were related. I mean, that's amazing, because I have arthritis and several of the things on the list, and I'm like, oh, well, maybe that's why.
So we'll probably work on practicing some mindfulness and some meditation, but I think really those are some of the things when we start thinking about and talk about is some of those questions at the end to be thinking about is, do you offer stress management workshops or kind of what we call like maybe a lunch and learn for employees to help them be able to understand what is stress, how do they display stress, what are some of the effects of it, and what can we do to try to help manage that? Because we'll always have a certain amount of stress that we'll be presented with, but it's how do you start to manage that stress?
So I know you do these types of talks in companies, and so I would imagine there are a lot of employees who are not aware of the link between stress and fatigue, and the fact that I think fatigue we all kind of get. That's related to your health, but stress and its relationship to your health and what things that you can do about stress. Somebody told me one time, I went to one of those stress clinics, and they told me one time that your stress is really what you create yourself. So other people do things to you, but it's how you react to it that really creates the stress. That was something that I remind myself of every now and then, because you can control a lot of your own stress by just how you react to other people and things that have happened.
And how you perceive those events, and if
Exactly.
there are things that you perceive as positive or negative, is going to impact how you then choose to respond to it and how you choose to see
And how
it.
quickly you let things go. Sometimes you think you're getting the other driver when you get all upset when they cut you off in traffic, when actually you're the one who's suffering the stress. You're better off to just let it go.
Absolutely. And we were talking about, so fatigue, stress, we know individuals who are stressed don't sleep as well. And so thinking about what are some of those effects of individuals who are sleep deprived. So we know there's about 6,000 accidents that happen, from individuals in regards to falling asleep while driving. We know that, individuals who are feeling stressed are more likely to crave high sugar, high fat, starchy foods. So I've never met anybody who says I'm really super stressed out, I'm craving carrots and hummus.
No. Nope.
I haven't met that person yet, but I'm sure there are individuals. But when we start to feel stressed, we tend to crave things like more sugary stuff, sweets, ice cream, cookies, things like that. That don't have a high nutritional value, but it helps to satisfy some of the hormones and stress hormones that are being released for that. And we also know individuals who have sleep deprivation are more likely to experience like depression as well. And so just taking a look and seeing, some of the other statistics on there in regards to health and how, sleep deprivation impacts. They're 3 times more likely to have issues, I think it says, with like colon cancer. So just being able to think about how stress can be related to sleep deprivation, that can be related to fatigue, and how all of those things can relate back to having things that individuals who maybe have a chronic condition who can experience, and even individuals without a chronic condition can experience as well. And thinking about, individuals who aren't getting their sleep. After 17 to 19 hours without sleep, it produces impairments in performance it should say equally, not equality, but equally or worse than a blood alcohol level of 0.05.
Wow.
So
I experienced that last week, actually. We had a long filibuster. I was up for 30 hours straight, and I felt I might as well have been drunk, by the end of that. So, yeah, I get that.
So, thinking about, employees who may be coming to work who are extremely sleep deprived, that's impacting their performance. And that also, when we talk about fatigue, it makes individuals more likely to potentially have a safety incident or injury. Sleep deprivation can potentially have that same impact.
Wow.
And so one of the things I also want to be able to talk about is mental health, because it is so important. And thinking about, we know 1 in 5 adults experience a mental illness each year. And so you can think about, it's like about 20% of your employees at any given time are experiencing something related to mental health, mental illness. So that equated to 47.6 million individuals in 2018.
Wow.
Some of the research shows that from the time an individual experiences initial symptoms of a mental illness to the time that they receive treatment is 11 years.
Oh, my goodness.
So significant length of time. And so being able to think about, supports and programs and resources to be able to do that. And I have resources listed at the end of this presentation to guide individuals to. So prevalence, the ones I focused on more are anxiety and major depression, because those are the ones
Sure.
that we see individuals most often experience. But that doesn't, we still have individuals who may be experiencing schizophrenia or bipolar disorder, other types of mental illness, but just focusing on those two, because those are the ones that we tend to see in individuals experience most often.
And they're also the ones that people are likely to ignore for a while, and think, oh, I'm okay, and they're not okay.
Yeah, and so thinking about what resources do you as an employer have available to your employees that let them know where they can go if they're experiencing concerns in regards to mental illness. Do you have an EAP program that's available to them? And just making sure that they're aware of what those supports and resources are out there. mental illness still has a significant stigma to it. And so wanting to make sure that we address that so individuals can get the support that they need as well. And as I said at the beginning, we know a number of individuals who have a chronic medical condition also have a co-occurring mental illness, usually anxiety or depression too. So one of the things when we talked about presenteeism, which is individuals who are at work, but they're not really functioning at their peak performance. And then we have absenteeism, which is when we know individuals aren't at work. And so right now it's estimated the cost of that is about $1,685 per employee per year.
Wow.
So when we think about employees and not being at work, we know that there's a lost productivity for that. So the more as an employer that you can work towards having healthier employees, the less often they will be gone, the less sick they are, the less your cost of absenteeism too.
And how important is that now in today's environment when you need everybody at work every day that you can? Yeah, it's, we know employers are having a really difficult time finding skilled work and skilled workers to be able to fill the jobs that they have. So yeah, I can see it's even more of a problem now.
Absolutely. So again, you're thinking about how as an employer do you manage those costs? Focusing on prevention, what can you do to encourage employees to participate in annual prevention and wellness checkups? Not only physicals, but dental is extremely important. We know that there's a link between dental and oral hygiene and cardiac health. So making sure that employees know what those preventative wellness benefits are and encouraging them. And again, that also goes back to making sure that there's not a policy that's punitive that prevents individuals from staying home when they're sick, but also from not utilizing and engaging in their preventative wellness benefits.
Sure.
Helping to manage chronic conditions, because as we talked about at the beginning, we know that's kind of one of the leading costs of healthcare, and talking about and looking at with your insurance coverage and what types of support or programs do they offer to those who are covered through the insurance to help manage chronic conditions. Sometimes they have case management programs that are over the phone, or they'll have materials or information or support groups that may be locally to be able to help individuals manage health conditions that they have. And then again, we talked about engagement, right? We want to make sure that we know employees who are engaged, who are healthy, miss fewer days at work. And again, looking at whoever your insurance is through, what kinds of tools do they offer to help employees with wellness and managing that wellness that you can take advantage of as an employer? So again, I always like to throw some of those things out there to think about. And we already talked about this. What does the current attendance policy encourage? Does it encourage employees to come to work when they're sick? Again, do employees have the option to work remotely? If they do have that option, making sure that you get that set up and that it's working prior to employees needing to have it, so it's not a last minute they can't come into work and then you find out that their remote connections don't work.
Right.
And also a kind of a reflection on leadership. If you are sick and you have a cold or something that your thing is contagious, do you stay home?
Right. Well, and isn't it important too for leaders to let their employees know it's okay? I mean, if you don't communicate with them, they're never going to know. And if you don't tell an employee, especially one who is really trying to impress and wants to be a good employee, and you don't tell them that you want them to stay home when they're feeling sick, they may think that you expect them to show up no matter what. And maybe it's a communication issue as well.
Yeah, that's a terrific point, Ray. Making sure that you're clear about the expectations in terms of when you're well, come to work. When you're sick and you may be contagious, stay home.
Because I have a staff of workaholics. I have to tell them, go home, which is a good problem to have, but you want to make them know that you're better off, the whole team is better off if they stay home when they've got something that they could give to someone else.
Absolutely. If you're thinking you need to come to work with one of those little paper masks on, that's a good indication that you should stay home.
Right. Right, exactly.
And again, we talked about, if you have an employee who comes to work who is visibly sick with something, do you let them know if they need to go home? Mm-hmm. And again, we're talking about, outreaching your insurance company to find out what wellness offerings are available through them. Some of them have wellness benefit packages that you can add onto your insurance. and in finding out so that you as an employer maybe don't have to create things, but you can pull from the resources that are already there and leverage coverage and benefits that you have. Another thing that I think is helpful is if you can work with your insurance company to run a report based on claims data to find out what health conditions employees could use support on. It doesn't have any personal identifying information, so it's just the data pieces, and it just looks at various codes and dollar amounts. And that's a good way to start to understand, again, what kind of support employees might need in terms of maybe managing chronic conditions or education programs, support programs. It's also another good way, as you had talked about, kind of leveraging technology and cobots.
Yes.
You can look for things about, like low back pain or maybe things that could be a repetitive motion injury, and then identify where, if you have a lot of those claims that are coming through, where are those opportunities then within your workplace environment that maybe you can leverage technology or a cobot to be able to help minimize that? Or is there that potential of rotating individuals through various stations so that you can minimize the potential for repetitive motion?
And having that data would be very important, because it could be something as simple as having an employee sit for a length of time and then stand for a length of time, and changing it up, which we all now have seen those desks, where you can raise them and lower them. I think it's no different probably in a factory setting either, where if there's an opportunity for you to be able to have an employee to sit down some and stand up some, maybe that's something that could help prevent work injuries and downtime.
Absolutely. We talked about, developing that relationship with a fitness center, or, for a discount, if there's not a fitness membership program available through your insurance company. Some insurance companies will have a fitness reimbursement component, where if you go to a particular fitness facility that's part of their reimbursement network for that plan, that you maybe need to go a certain number of times, like 6 or 8 per month, and then you get a certain dollar amount back towards your monthly membership.
And that also impacts your premiums. So as an employer, the more employees that you have that take advantage of that, the better off you are, because that'll definitely go into the amount that they calculate as your premium.
Absolutely. We talked about, those lunch and learns, those short educational opportunities. It doesn't need to be a half day. It can be something that's 15, 20 minutes, 30 minutes. Something to help, educate employees about, different stress management things, since we know that finances tend to cause individuals a lot of stress. Mm-hmm. What could you possibly offer, in regards to financial management education, and again, disease-specific information? We talk about, can you create that committee to help you create that organization of that culture of wellness, and start to think about some of those ideas, some fun events, some fun challenges, to really support individuals towards wellness and engage them as well.
Yeah, you mentioned teams. I immediately think of The Office, the sitcom Office, where he knows everything that's good for his employees, but maybe a team approach is better, where you really figure out what.
And we talk about too, is there a walking path where employees can walk during their lunch? Depending on where your facility is located, is there kind of a map that you can draw out around take these various blocks, and that's a quarter of a mile. Mm-hmm. Depending on location, is it something that you could create, a walking path around your building and encourage employees on their lunch to go utilize that? And that could be one of the challenges, mm-hmm. In terms of doing that. I don't have this on there, but, we talk about wellness components. Do you have that, as an employer, do you have vaccine clinics? Do you have, in the fall, do you have a flu shot clinic? If your demographics, indicate that you should be offering the pneumococcal and the shingles vaccine, do you do those types of preventative vaccines? Are you looking at your restrooms? Do you make sure that they always have soap in them? Because, hand washing, washing your hands, regular soap is just fine. Warm water, sing happy birthday. I always say front, backs, in betweens, and you're supposed to do up to your wrist. Do you have signs that show what good hand washing technique is? Do you make sure, like I said, that you've got the paper towel and the soap there?
Let's go back to happy birthday.
Yeah.
So yeah, what is that? How does that go? You sing happy birthday to yourself twice?
Well,
hopefully not out loud.
Yeah, at least one time. You can just do it silently and think about it in your head and singing happy birthday in your head as you wash your hands.
That's about the length of time.
That's about the length of time that you should be washing your hands to make sure that you're getting them clean.
Because if you sing it out loud, they may refer you for mental health help.
Yeah, either that, or you might just start a party in the bathroom while everybody's washing their hands.
Or get discovered and be on The Voice.
Absolutely, you never know.
Could happen.
If you have a smoking cessation program or that benefit is available to through your insurance, making sure your employees are aware of it, because we know it's one of those risk factors for individuals developing chronic conditions. And if you have a number of individuals who are engaging in that, do you have the ability to create kind of an unofficial or informal support group at work for that? The same thing, if you have that health risk assessment program, or HRA, some of them will call it, through your insurance, are your employees encouraged to participate in that? And then if they participate, what is that follow through in terms of helping them set goals to help increase some of that sense of wellness? And we know wellness is a very subjective, it's very subjective. It's based on individuals and how they feel. But we know how individuals feel about their wellness ends up having an impact on them.
Of course. And if they feel better, they're going to feel better about working for you, which is what we all want right now. We want to keep our good employees, right?
Yeah, absolutely. And then again, reflecting on, do you have an employee assistance program or EAP program available? If you don't, is that something that you can get? And if you do have it, do you make sure that your employees are aware of it and how to access it if they need it?
Good advice.
One of the things I love is, so Benjamin Franklin, right? An ounce of prevention is worth a pound of cure. We know that if we can take proactive and preventative approaches, that it's going to be much more cost effective, and individuals are going to feel healthier if we can work to do that prevention piece.
Of course.
Versus treating it after the fact. And he knew that back in 1736, he was saying. So tried, time tested, and true words of advice.
Right.
So as an employer, if you're thinking about, well, how do I know what to work on, right? I want to become a healthier workplace. So the CDC, which is Centers for Disease Control, has a scorecard that's available to help you evaluate your workplace. It's called the Worksite Health Scorecard. I have the link posted here. I don't want to scare you off. It is about 75 pages, I think, because it looks at and asks questions from a whole bunch of different aspects. And it's really a thorough and comprehensive evaluation on wellness. And what that scorecard can help you do, there's an opportunity for you to benchmark yourself against other companies. You get kind of a grade on it, but it also, the most important thing is that it helps you identify those gaps and areas of improvement related towards creating a healthier workplace.
Sure.
And that's the goal. You have to start someplace. So it's not expected that you're going to do it and you're going to kind of have a really high score. It's meant to help you think outside of the box of different ways and opportunities that you can start to create a healthier workplace. And baby steps is really kind of what it takes. When we talk about health and wellness, it's not just an easy button that you're going to push.
Right.
It's something that it does take some time to be able to implement and get in place.
Sure.
And this is an area I'm extremely passionate about, so I have my contact information up there. So if you are interested in working towards creating a healthier workplace, or you want somebody to walk through that scorecard with you and help you to identify those areas, and then to help to create a kind of a plan moving forward to close some of those gaps. I'm always interested in helping places do that, or as we talked about, some of those other things to think about, and you can get that information. How can you design some of these workplace wellness incentives or programs to help encourage employee wellness? Happy to help out with those things. And as I promised and indicated throughout the time, I have some links from different wellness resources. So the Society for Human Resource Management, the Workplace Wellness of America is called WellCOA. It's an organization that you need to have a member, that you, to access a lot of their information, you need a membership, but they have conferences and a lot of great materials for employers. NAMI, which is the National Alliance on Mental Illness, is a great resource if you're needing support or resources, or looking for some infographics to post in your workplace about mental illness. And then Centers for Disease Control has a lot of information about worksite health and some of those initiatives. And then the Substance Abuse and Mental Health Administration as well for another resource. And then I'm certainly open and interested in any questions that you have, so please ask away.
All right, wonderful. We'll open it up now for questions.